everyone. This is Dr. Raymond Gasky from Bradford Family Chiropractic. I have Marquisha here helping us out. Today we're going to be going over a couple of quick maneuvers, FAkTR maneuvers for posterior hip. So this is going to be an indication where we have either posterior hip pain or sometimes anterior hip pain. Psoas contraction, sometimes even osteoarthritis of the hips. Our goal right now is to improve internal and external rotation of the hip. Using FAkTR protocol, the first step we're going to do is we're going to be using our FAkTR tool, our scraper, any other type of IASTM device to see if we can loosen up some of the tissue. So we're going to be working on the IT band for roughly 30 seconds. And with FAkTR, our approach at first is going to be static, working this tissue down. We're going to be working through the glutes, glute med, into the piriformis, into the glute max, looking for adhesions and breaking them up. Is that okay with the patient? So far, so good. So we'd be doing this anywhere from 30 seconds to 2 to 3 minutes. The next phase of FAkTR says we want to activate some of the musculature. So we're going to choose to work on the posterior complex. So the active component is going to be, in this case, it's going to be doing a clamshell. So we're going to instruct the patient to open up the hips and slowly bring them down. And we're going to do this for about 30 seconds to a minute, working the same tissue. Heavy focus on that posterior portion of the hip. And again, I'm just using my tool just to scrape out the glutes, the piriformis, some of the deep hip rotators as we work. So we'll be doing this for about 30 seconds. Now, the next phase of FAkTR we're going to approach today is going to be doing the same treatment area, except we're going to be adding a little resistance to that external hip rotation. We're going to choose to use a TheraBand, and we're going to have the patient help us with this one. We're going to bring this to the knees and to the thighs. We're going to bring the legs down. Now let's attempt that. Are we able to open up those clamshell? Are you feeling a little resistance in there? Not too painful? So now we're going to continue. We've gone from static to active, and now we're going into a resisted form of external rotation of the hips. Again, heavy concentration down in that glute med and piriformis region. One of the premises here is to put the patient through a provocative measure, to put them through a motion that somewhat irritates the complaint area. In this case, the complaint area would be a form of external hip rotation. Okay. So again, that was a brief demonstration of FAkTR protocols for posterior hip or external pain, pain with external rotation of the hip. This is Dr. Gasky at Bradford Family Chiropractic. Thank you.